All right, everybody. Welcome. Thank you so much for being here to the Allume COVID-19 preparation and planning meeting. I thought it was really important that we come together and talk together as a community and address everything that's going on. It's super important that we're all on the same page and that you're informed. So this will probably be the first in a series of communications that we have to make sure we're all on the same page. This isn't going away as much as I really wish that it was. It is a reality that we are facing, and it is an opportunity for us all to be a part of the solution. So here we go. So while the risk of contracting the coronavirus remains low, it is now time for us to prepare, and this is not at all a way for us to panic. So I want you to really write it down next to you. This is a time to be prepared. This is not about panic. This is about getting our ducks in a row. And what we've learned, what the CDC has learned, what the Department of Public Health has learned, what we have learned is that we can do a lot to keep ourselves safe, and we can keep our patients safe. And I'm going to ask you all to do some things today and to change some behaviors in your life that will probably be uncomfortable and things you don't want to do, but it will be in the service of us all not ever needing to panic. It'll be in the service of us all serving our community and being ready to deal with whatever comes our way. So again, not a time to panic, it's a time to prepare, and it's a short-term series of interventions I'm going to ask of you. So today we're going to talk about our intentions, what is COVID-19, the context of COVID-19 compared to other things in the world that you might come across, and then what can we do? What are our policies? What are our practices? What we're asking individuals to do, and what we're going to ask families to do and how to participate. We're also going to talk to you a little bit about what's next and what could happen next, not just with Allume, but in general, what might happen in our community and the things that we need to just digest. And if you're like me, I've been compartmentalizing this a little bit. I've been kind of keeping myself not thinking about it too much and kind of, okay, this thing has happened in these other places, but it's not going to happen here. And now we need to sort of adjust and adapt to the idea that it is here, and we don't need to go crazy and the sky is not falling. This is a manageable situation, but there are things that we can do that will be in the service of our safety and the safety of our patients, and there are things that we can do just continuing on in sort of old patterns that will put us all in the path of COVID-19. So again, our intentions is that we have the power, okay? We are a team of 150 people. We serve 150 people in the community, most who are extremely vulnerable. We have the power to make a huge difference in our little community here in Connecticut. We have the power to make a difference to our communities at large, our patients, our families, and ourselves. And really, I would say that, we are in healthcare. This is the reason we exist. This is the reason you became a nurse or a CNA or a home health aide. This is the reason you joined Allume, because we're here to provide remarkable care to our patients, our families, our employees, and our communities. And this is the time that we need to step up and demonstrate remarkable care. We are here to lead and support, and we have the power to get ahead of COVID-19 if we make some very deliberate, intentional, and somewhat inconvenient choices in order to support and protect ourselves and our vulnerable patients. This is our opportunity to prevent the spread to our patients. All of this is in that service. Our number one goal is to implement safety precautions now that ensure all of our patients are not infected. Okay, most of us are probably not, it's not the end of the world if we get this virus. It's a virus. We'll get sick, we'll have some stuffed up nose, we might get the pneumonia at the very worst, we'll cough, we'll sneeze, we'll stay home, we'll drink soup, we'll tend to ourselves, right? But for our patients, for our vulnerable patients, who is our responsibility, our mission, they can't tolerate this disease. This virus is extremely deadly to them, and we need to do everything in our power to keep it from them. So we are fortunate to have the time and the information to prepare. This is not a time to panic. This is a time to be very clear, decisive, in control, have the facts, and just do the things we need to do. So with the exception of the vulnerable populations, and the large majority of cases will present like a bad cold or any typical virus. But because we are serving people, and because there is such a long time, this 2 to 14 day incubation period before symptoms can appear, we need to be really careful that we are not the ones who are bringing the virus into the homes of our patients. So today we're rolling out a series of precautions to ensure zero incidence of COVID-19 with our patients and with our team. They go one within the other. And while it's probably fine for you or me to get it, it's not fine for you or me to take it into the home of a patient. And since we won't know for 2 to 14 days whether you're symptomatic and whether you have it, we need to pretend like we all could be carrying it at all times. And we need to act in ways that allow us to prevent that exposure to our patients. So our biggest risk to our patients right now is us and the people around them. So each family, we want to think about each home, each patient themselves. Hopefully they're not spending too much time in the community at this point. Most of our severely compromised patients are home pretty consistently anyway. So they're not out and about to have the risk. You can't catch this if you're not exposed to it. If I went home and I stayed at home, and my family, we all stayed home, and none of us are symptomatic, none of us are going to get it, right? I know it's not fun, but that's the truth, right? So our patients, if they're at home and they're safe at home and they're not symptomatic, as long as no one brings it into the house, they're not going to get it. So our job is really to prevent them from getting it by keeping the risk of ourselves, family members, and anybody else who might be in a patient's home from bringing in the germ. So we must take some precautions. We must take what I call zealous personal precautions to prevent spread. We have the tools for infection control, and we'll be asking you all to participate in these two areas of, taking some precautions as well as infection control. So our intention is to work together with each patient and each family to ensure the safety. We want to keep ourselves free of COVID-19. We want to empower you with the tools and knowledge to make this possible. And we'll be asking everyone at Allume to make some short-term changes in behavior to ensure we all remain COVID-19 free. So what is COVID-19? Coronavirus, also known as COVID-19, is a respiratory illness that can spread from person to person. You can find lots of information about this on the CDC website. The virus that causes COVID-19 is a novel coronavirus. So there's lots of strains of coronavirus that exist out in the world. This is a new one that they think came out of the outbreak in Wuhan, China. And what happens is that it's inhaled, this virus, this this conical thing is inhaled and it attaches itself into your lungs. And because it is a new virus, our bodies don't already have antibodies for them. So our healthy immune systems will fight them off by developing antibodies and then attacking them and eventually ridding our bodies of it. That is in a healthy situation. So I want to show to you a video that Dr. Lim, an epidemiologist that the CDC has largely, been focusing their attention on. So I'm going to try to do this. See how we do this. New share. All right.
So we need to get the facts straight. How does this virus work? How does it transmit? Where does it want to go? And let's protect ourselves. I'm Dr. Peter Lind. I'm a family physician in Toronto, Canada. The coronavirus is a family of viruses that can cause as mild things as just a common cold, all the way up to SARS or MERS. These are the bad pneumonias that we're talking about. And basically what these viruses are, they look like a tennis ball with all these spikes sticking out of it. And depending on the type of spike, it allows that virus to attach to certain places. So some viruses, they have the spike that attaches to your nose. So basically you just get a common cold. But the SARS virus and this new virus that we're talking about has the spike that allows it to attach to the cells in your lung. And when it attaches there, it puts in information to make photocopies of itself. So it uses our equipment to make more viruses.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Most of the coronaviruses live in animals. In this particular case, it was from Wuhan. There was a fish market where they were selling live animals. And the thought is that the virus was in a live animal, then it crossed into a human. But then what we found was that people were getting sick in terms of healthcare workers, in terms of family members that were looking after them, which now meant that the virus could pass from human to another human. Just like all viruses, it needs to reach a target, which is your lung. And it has to get there with your help. It has no feet and no wings. So therefore, it needs us to move it there. So that's why we keep saying, don't hang around sneezy people because you're going to breathe it in. And don't touch your face because that's how the virus is going to get in. The masks are helpful, but they're not necessary because they're leaky. The ones that you and I buy basically have pockets here, so therefore the virus can get in. What the masks really do is they stop us from touching our face. If you're sick, we tend to mask you, so therefore you're not spewing out the viruses to other people sitting around you. The true people that have the real masks are the N95. Those are sealed. These are for the doctors that may be caring for the patients. So in the beginning, the coronavirus will cause kind of like flu-like symptoms or a cold. So people just get the stuffy nose, that kind of thing. But you'll understand that as soon as that virus starts manufacturing in your lung cells, they're producing all these copies of the virus, all of a sudden now you kill the lung cells. So now you can't exchange oxygen. And that's why one of the early symptoms is people get very short of breath and they tend to have a difficult time breathing, and that's why they end up in hospital. So currently, unfortunately, we don't have a direct treatment for the coronavirus. So we don't have a medication that can kill it off. And so it's really supportive. So in other words, the patient can't breathe, we give them oxygen, help them to breathe. They can't drink, so therefore we give them fluids to support them. Their kidneys begin to shut down, we help them with all those things. So it's a very supportive process. This is a new virus that we've never seen before. So our immune system, our army, are having a hard time figuring out what to do. So usually what we have to do is we make something called antibodies. So these are things that can grab onto the spikes that we see on the virus, and it will get rid of the virus for you, and that will actually bring you back to good health. So therefore, the elderly may have a worse outcome. And of course, the young children, so the babies, their immune system is not so good either, so they may not make those antibodies as well. So just remember, your hands may be with virus. The virus cannot hurt you because it can't get through the skin. But the moment I do this, now I've brought the virus right to where it wants to go. So let's remember not to touch our hands to our face. So let's say you think that you might have been on a plane or you might have bumped into somebody that has it. What should you do? So the first thing is to contact a healthcare worker to tell them that potentially you have it. If you're feeling symptoms and you're going to go into a facility, call ahead. Okay, so whether you're calling the paramedic or whether you're calling the hospital or your doctor imagine that you were on a flight. If you don't have any symptoms, then what we do is a little bit of a self-quarantine. In other words, we can just keep you away from other people, and so you don't go into parties, don't go with your friends, don't go into public transportation. So we can contain it very easily by making sure that you do a self-confinement, so to speak, for the, let's say, 7 to 14 days is the longest incubation time. So after that, if you're feeling well, then you don't have anything to worry about. If we get the facts right, then we don't have to be overly worried, but we do the right things so that we don't get the virus ourselves and that we don't pass it on to others. And if we look after each other in this way, this virus will have nowhere to go. It needs us to move it. It needs us to make copies for it. And if we don't help it, then the virus will stop. So we have the power to do that right now.
Okay, so that is intended to be some information for you to digest. Now we come back to the presentation and discuss what's next. So, all right, so how is COVID-19 spread? It spreads from person to person, mainly between people who are in close contact with each other. 6 feet is kind of what we want to try to avoid, try to maintain distances of 6 feet. And it happens through respiratory droplets that are produced when a person who has the virus sneezes, coughs, exhales. Possible that a person could also get it by touching a surface, a keypad, a cell phone, a door handle, any kind of common surface that we come in contact with, and then you touch it, and then you touch your face, right? You touch your mouth, you touch your nose, you touch your eyes. Now it's in your system. That's how it gets passed. So symptoms are fever, cough, shortness of breath, breathing difficulties, and the symptoms may appear anywhere from 2 to 14 days. There are some other signs that you could have it with, sore throat, fatigue, nausea, so forth. But these are the primary things that the COVID-19 expresses. And what it looks like if it's severe is pneumonia. It can cause multi-organ failure, and in some cases it can cause death. So the treatment is, as Dr. Lin pointed out, there isn't a antiviral treatment for it. There is supportive care only, so oxygen fluids, perhaps there'll be a vaccine. They're saying 12 to 18 months away. So what to do if a COVID-19 is suspected in yourself or in someone else? So if someone is displaying these various symptoms, they should be seen by a healthcare provider, whether it's at a call. They would need to call their primary doctor or go to the hospital if they're at that stage. And the healthcare provider will advise on whether a test is recommended and how a test gets done. It's important to remember that not every flu or every sneeze that you have at this time of year certainly is COVID-19. As a matter of fact, probably not. National levels of flu-like illness are still prevalent. Here we are in mid-March. We still are in flu season. So most likely you have a typical flu. Children have been hit hard by the flu season in general. And CDC estimates for this flu season, we've had 32 million flu illnesses for this year, 310 hospitalizations and 18,000 deaths. So this is going on anyway. This is not COVID-19 is sort of next to the flu, right? As another kind of virus or series of viruses. And so this isn't uncommon for us to have this kind of infection present in our communities. And so it's important to remember that this is not, this is something we deal with all the time. So also in the larger context, it's good to look at other, so we talked about flu, but then there's also SARS and MERS. SARS was from 2002. There were 8,200 cases, 775 deaths, 9.6% death rate. MERS was in 2012. There were 2,200 cases. There were 800 deaths, a 35% death rate. I found this in a presentation yesterday. Maria and I went to a emergency preparedness training in Torrington, and they showed this data, and I thought this was interesting. This shows you, so this little dot, this little yellow dot represents the one person who has whatever the illness is. In this case, it's MERS. And so it's showing that one person infected probably infects one more person. So one person of influenza infects 1.5 people. Ebola infects 2 people. COVID-19 is about 2.5. So it's more infectious than MERS or typical flu or Ebola. Well, Ebola is a whole other crazy thing. But it's not as bad as SARS or mumps or rubella or smallpox or measles. So this is just some data for you to digest. So every person who gets it, they're anticipating that 2.5 more people will get it. So as a general context, as of yesterday, there were 121 confirmed cases worldwide. 66,000 have already recovered. 44,000 deaths worldwide, and 2 confirmed cases in Connecticut. 0 deaths in Connecticut. It's likely that it is underreported, particularly in the United States, due to limited ability to test. There aren't as many tests as there are people who would like to be tested. But it's something for us to just be aware of. This is some of the data. So here is what CDC recommends, and you can find this on the CDC website, but what they recommend for vulnerable populations and for people who are in contact with vulnerable populations. So you want to make sure for your vulnerable people that you stock up on your med supplies, your meds, your medical supplies, your grocery items, cleaning supplies, masks, tissues, etc. You probably are going to have a hard time getting some of this, but just be calm and know that you can that look around and see if you find that a patient doesn't have access to some of these things. Please let us know and let us help you figure out how to get that for your patients. We want to have people take everyday precautions to keep space between patient and others. So we want to avoid and eliminate contact with sick people, obviously. Hand washing precautions, and part of our training this month is going to be on hand washing. You want to avoid touching high-touch surfaces, elevator buttons, door handles, handrails, handshaking others. You want to be washing your hands after touching surfaces in the public. You want to avoid touching your face, nose, eyes, etc. You want to clean and disinfect your home to remove germs. Your home and your any spaces that you're in, your office, your environment, your work environment. Routine cleaning of frequently touched surfaces like tables, doorknobs, light switches, handles of any kind, your desk, toilets, faucets, sink, and cell phones, all very important. And the other big one is no crowds, not being places where there's a lot of crowds. And really, the encouragement is to stay home as much as possible. Get yourself away from people who might have the virus. What you can do, you can clean your hands, wash your hands for at least 20 seconds. Hand washing is better than using hand sanitizer. So if hand sanitizer is not available, use a hand sanitizer that contains at least 60% alcohol. Make sure you really cover all the surfaces of your hands and rub them together until they feel dry. It's not officially done. The germs are not gone unless you do this. You really want to avoid touching your hands, nose, and mouth. And that's hard, I know. Avoid any close contact. So, in general, we're recommending that you avoid close contact with people in general. Try to stay, because you don't know. You don't know if the person next to you has the virus. So we want to limit, give yourself space, give each other space. Put distance between yourself and other people in general. Stay home if you're sick. So stay home if you are sick. Expect to get medical care. Cover your coughs and sneezes. Cover into the inside of your elbow. If you're going to use a tissue, immediately don't reuse the tissue. Throw the tissue away. Go wash your hands after you've used the tissue. At least 20 seconds again. Wear face masks if you're sick. And again, this is less, it's not 100%, but they're recommending wear a face mask if you're sick. And that way you're not spewing out the virus at other people. And when you're caring for someone who is sick, have them wear the face mask and you yourself wear the face mask. It does give some level of protection. Clean and disinfect. This is what we can do. General, back to your basic infection control. Clean and disinfect frequently. Touch surfaces. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Handshakes. As a community, don't shake people's hands right now. Avoid hugging. Personal contact right now is just not a good idea. The wave, the tie wave, the elbow, the foot shake, all different kinds of ways we can wave and we can acknowledge each other in a friendly way, but no handshaking. Here's some information on cleaning and disinfecting, which we will certainly be spreading around how to disinfect. I know there's a lot of issues right now with getting disinfection solutions. Clorox is hard to find. Wipes are hard to find. But you can make a bleach solution at home for yourself. We are working on getting extra supplies here in the office as well. So what we can expect, and this is the sort of like nobody wants to think about it, but we need to think about it. We need to come into clear focus about what could happen next. And what is happening already, we're starting to see school closing. We're starting to see cancellation of large events. I believe it was the NBA last night that canceled the rest of their season. Areas of breakout and subsequent quarantine, we'll see that starting to happen. We saw it in New Rochelle, right? There was, some spread there, and now there's a quarantine. We will probably see more of that. You'll see companies implementing no visitor policies, telecommuting policies, et cetera. You'll see more and more and more of that. Hospitals are shutting their doors, skilled nursing facilities are not allowing visitors, a lot of them. There's a lot that's happening. We'll start to see, and they already are, at or over capacity, right? And that I want just for you to think about. So if hospitals are capacity and we have these vulnerable patients, going to the hospital is not necessarily the safest and best or even, a good option for them. So we really are on the hook to make sure our patients stay home, stay safe. Reduction of available healthcare professionals. This is a big challenge that Italy is facing, a lot of the other countries are facing. Because of the exposure themselves and needing to be quarantined, infection themselves and needing to get well. There's also, when the school closes, then there's childcare issues. So there's, en masse, there's this challenge, and you and I, we're all going to face this. So our community, our patients need you to be able-bodied, need you to be well, and need you ready to serve, because the need is going to increase, not decrease. Probably members of the team will have reasons why they've been exposed and so forth and won't be able to come to work. We will need to rally around our patients and families to serve them. So the other thing is that COVID-19 testing, so they're, just to keep you informed, data, this came from the Connecticut Department of Public Health state laboratory. So far, a total of 74 individuals have been tested at the state laboratory. 71 have come back negative and 3 positive. So again, people are having colds, and by and large, right, most of them are not with COVID-19. At the present time, testing for COVID-19 is only being done at the state public health laboratory and only on patients who have severe respiratory diseases or are hospitalized. I know there are some places where you can get tested as well. There's individual doctors that have testing, but by and large, we have very, very few tests. DPH expects testing to be available at acute care hospitals in the next week or two. And to make testing more widely available, DPH is working on getting alternate sites approved for testing and working with labs, including Quest Diagnostics and LabCorp, to complete the testing. So there'll be a lot more information on the testing piece coming out. So, I mean, some information I think it's important to know is that keeping a community safe and preventing the spread, they've shared with us, happens either by having a large amount of testing available. So the minute a person is starting to feel uncertain, they take the test, they come back, it says no, okay, that person's fine. It says yes, you have COVID-19, okay, that person is immediately quarantined and it's not spread. But in situations where there's not a lot of testing, we're at a higher risk of spreading because people just are walking around with it without knowing. So the other option is for people to be more and more self-contained. The areas where they are able to cut it off in Korea, they've had, you know, high testing and high levels of self-quarantining, self-limiting themselves to exposure. So our approach is as follows. We're asking our employees to not travel, to stay in Connecticut or within 3-hour driving distance. Do not travel to affected communities with confirmed cases. We're asking you to avoid that as best you can. Travelers outside of 3-hour driving limit or to known affected areas, for example, if you decided to go to like a New Rochelle, which is in 3 hours, you know, if you travel to these places, we ask that you let us know and remain in quarantine at home for 14 days before you return to work. We're asking to have as many virtual meetings as we can. We want to have meetings that are virtual, unless if there's some, you know, it's like some types of classroom training do need to take place in person. So we will continue to do that for the time being. We're asking you to refrain from being in crowds. Don't go places where there are lots of people. Don't go places where there's lots of germs present. Avoid parties, events, movie theaters, bowling alleys, malls, even the grocery store. We're asked, so at our meeting yesterday, people who interact with vulnerable people should probably not be going to the grocery store. Have someone else in your house go to the grocery store, or have someone else for you go to the grocery store. I know that's an inconvenience and you're like rolling your eyes and you think, oh my God, I don't want to do this. But this is how we stay safe. This is how we keep our vulnerable people safe. This is how we keep ourselves from having, you know, an epidemic that just spreads all over the place and lots of our patients, you know, in the hospital or worse. No handshaking. Please handle your food carefully. Please don't share your food with people. Limit the number of people you interact with, family and close-knit friends. Avoid people, you know, who have been in crowds. Try to observe a 6-foot limit with people. We understand you're going to need to be in touch with your patients, and you'll be in touch with your families. But in general, try not to be closey to lots of people. We're asking you to clean and disinfect at work, and both in the office as well as in home, at least every 4 hours, and certainly upon every visit. So if you're going from visit to visit, make sure you're cleaning and disinfecting wherever you go. Follow CDC's guidelines for preparing your household. We're going to be sending that information out in a separate email. And so self-quarantine, anyone who has been exposed within 6 feet of a person with a confirmed case of COVID-19 will be required to self-quarantine for 14 days before returning to work. That is what is required. When you are ill, don't come to work and don't go into the community. Don't spread it. This is our approach. This is what we're asking you to do. I know it's a lot. Moving on, so in-home practices and in the office as well, what we need to do. So we're going to be instituting immediately the 3 questions rule, and this is what we're hearing guidance from Other home health agencies are starting to do this as well. Some have already started. I know doctors' offices have been doing this, and we need to get on the same page and do this. So this is required every time a visitor comes into the building here at an Allume office, but it also is required every time you start a shift. It's also required anytime a new person comes into your presence from the outside, or a family member that you interact with in a home. So if you're on shift, you get to work, you ask these questions. And then if a new person comes into the environment, you need to ask these 3 questions. We're going to give you a flyer that should be posted in every house. And we will be sending out an announcement letting families know that we will be asking these questions as a way to protect ourselves and protect their loved one, and also as a method of education. So the questions are, have you traveled outside the U.S. in the last 2 weeks? And so you've been seeing them, the question be, have you traveled outside, have you traveled to China? Have you traveled to Japan? We're starting to tighten that up now. Have you traveled outside the U.S. in the last 2 weeks is what we're, as a company, asking. We're saying, if you've traveled outside the country in the last 2 weeks, you've been exposed to the airport, you've been outside of the country, we observe you as being a slightly higher risk for COVID-19. Do you have a fever? Do you have a cough or shortness of breath? Answer comes back yes for any of these things. What we're asking you to do is give that person a mask, and then you yourself put on a mask. And if you have a patient, put a mask on that patient. And then make sure you observe at least the 6-foot rule. If the person is sneezing and so forth, by all means, try to encourage them to move away from the patient and move away from you. Clean and disinfect every 4 hours when you're in the house, and follow infection control procedures thoroughly. So partnering with families to limit their exposure. So we will be sending out some information to our families, educating them on COVID-19, on household preparation, on what to do with vulnerable patients, how they can limit exposure to COVID-19. And we will suggest vulnerable patients stay home. People living in the home limit exposure to crowds. And we ask them to elevate their own infection control practices in their home. And we'll let them know, as I said, that we'll be asking them these 3 questions at every visit, every shift. There will be more training coming out in the march-in services, but more than that, more important than that is things come out and we find things that we feel are important for you all to know. We'll be emailing out to you. We ask you to please read your emails and texts. Our goal is to keep you and patients safe. So this is not a time to panic. It is a time to be clear and directive. We have the opportunity to help our community and to lead in our community and provide safety for our patients. We must stay healthy. And to do this, we must limit our exposure to COVID-19. We have to sort of semi-quarantine ourselves, limit our activities out in the world as much as none of us like that, and practice rigorous infection control at work and at home. So now I'm asking you all, if you have any questions, to please send a text message, or there's just a chat function here. Chatting, okay. So right here, I'm asking questions. Any questions on the group chat? You might not have any questions. You might just be completely overwhelmed by all this. I hope not. I hope this is not overwhelming. I hope that you will see this as an opportunity for us all to hit the ground running before the storm approaches. I think that what Dr. Lim said about, that this is not, we put this in our system by going out and putting it in our system, touching things and putting it in. So we have the power to secure ourselves and our patients. All right, I'm not seeing any questions from the peanut gallery. All right, well, I just want to say thank you for being at the front lines and for caring about our patients and for making this your mission in life to serve our population. and I look forward to connecting with you. If you have questions, please feel free to reach out to me directly. I don't know what the next weeks hold. I don't know what the next days and weeks and hours even hold. We need to be fluid. We need to stay positive. We need everybody to come to work as often as you can. Our patients need you to keep them safe. We need to really ask everyone to sort of step up during this time, and please avoid situations where you can be exposed to the virus. All right, that's all I got. Hope you have a wonderful day, and please go make the world a better place.